Welcome back to KC Cares, Kansas City's window on the nonprofit community and the people they serve. I'm Ruth Baum-Biggis.
And I am Bobby Keys.
And we are back.
Yeah, towards the end of the year, we're getting all this information. We had our doctor of philanthropy on and gave us that. I love the knowledge that he provides.
He has so much knowledge. It's unbelievable.
You know, and a lot of profits need that. I mean, instead of like paying fees, that you get it free.
You get it free here on KC Cares. Mm-hmm. That's why we're here, and that's why we're working in the nonprofit community. 11,000 nonprofits in Kansas City.
Wow, that went up.
Which is, well, that's with our religious institutions.
Oh, yes.
Affiliated. 9,000 something if you carve that out. It's still amazing. When I tell people or family who live on coasts about that, they just are floored.
Yeah.
You know, we used to be the flyover. Mm-hmm. We're not the flyover.
Yeah.
We should be the stopover.
Yeah, matter of fact, we got major nonprofits here. I mean, they're
Absolutely.
doing awesome things. When I say major, like just they're making waves in the nation, where and across the world with advances in different areas of our lives, whether it's cancer.
Which is our next guest.
Yes.
Great segue. The Susan G. Komen organization here of Kansas and Western Missouri. We are so honored to have Erica Terry with us. She's the CEO and Executive Director. Welcome.
Thank you. Thanks for having me.
Yeah.
I appreciate it.
Now, you're new.
To this role, correct.
Yes,
I've been
to
on
this
board
role.
for 7 months now, but I've been working, my heart and soul is in the nonprofit world, especially Kansas City. I love Kansas City, but I'm excited to take on this new role.
Yeah.
We serve 105 counties in Kansas, whole state of Kansas, 7 counties in Western Missouri, and that's new for our affiliate. And so it's a big job. We have a lot of people counting on us, and I love the opportunity to really lead with impact and redefine what Komen means for this region. We've been kind of stagnant for a bit, I'll be honest. Most people just think pink ribbon and the race for the cure, right? But I'll be honest, I'm not a huge event person.
Oh, okay.
And I'm more interested in making an impact and solely focused on the mission. So I've had a lot of discussions with my board and talked about, we need to redefine what impact means for our affiliate.
So that's awesome because we were talking about that earlier about impact and impact communication and the importance of it, right? And that's how you really reach donors. True. So where I guess is it come down to obviously messaging, but it seems like there's just an element of marketing that's missing, and it's not being concentrated on, or it's being overlooked, or we know that nonprofits don't get marketing budgets or whatnot, but how do you really communicate that properly? Does it begin with your staff?
It's everything, but quite honest, I'm a firm believer that your impact drives your revenue. Not the other way around. A lot of nonprofits come from the perspective, if we only had more money, we could do more. But I actually believe the bigger you dream, the bigger vision that you have, your revenue will follow. Yeah. And so when I came on board first and met with staff and met with our board members, we first off dreamed big. I said, okay, if we had $100 billion, what would we do? We need to start there. Think really big, because people will follow when your vision and your mission is big. So again, your impact drives your revenue. And how do you get that out? Well, I think it's important to make sure that people know that we are at the table. We're a part of a lot of regional coalitions, statewide coalitions working together. I'm not interested in who gets kind of credit for achieving our mission to end breast cancer. I just want to get it done. So I firmly believe in partnership. I firmly believe in working smarter and not harder. Yeah. And again, leading with impact.
And so I'm curious, when you did ask him that, and they said you had what was the answer? What was the number one response?
Well, we know that screening saves lives.
Okay.
We know 100% screening saves lives. So the big question, or the big answer to that, if we had unlimited resources, we would make sure everybody got screened.
Go ahead.
everybody got screened starting at age 40.
Okay, I was about to ask, when's the time? Because I have 4 daughters, right?
Yeah.
So me, and I'm pretty involved in their life. We talk about everything, so I'm not one of those dads that doesn't talk about.
Good.
I know you're a woman. I know what goes on, and I know what needs to happen. So what is that? You said 40. Okay.
Start screening at 40 and look for the warning signs. I mean, we've been doing, actually for Komen, we've been doing a listening tour throughout the state. I've been to Wichita, Hayes, Salina, Pittsburgh I go to tomorrow, Topeka, Garden City, which is 9 hours away.
All the crazy towns.
Other side of the state. And one of the big messages that we've heard, that we want people to start thinking through, and it'll be a paradigm shift, but you have to make your health a priority. Yeah. Regardless if you're a woman or a man or a child or a senior, whatever it is, you have to make your health a priority. The notion that we have a vehicle, if you own a car, you take care of it. You change the transmission fluid, you put gas in it, you change the oil, but people don't do that for themselves. So how do we change the paradigm that you have to put yourself first and look for the warning signs and go and get your annual pap smear or your annual screening mammogram? Make that a priority for people.
Yeah, so you would think they would start at an early age.
Yeah, I'm surprised it's now 40.
Oh, for screening, that's the screening guidelines for mammograms.
But to shift the paradigm, saying that, like self-care, I guess it would be, self-awareness, self-care, or whatever you want to call it. Like,
so that you can detect a lump if you're doing a breast self-exam at home in the shower. Being aware, and a lot of the discussion that we're having kind of across the state and region that we're hearing now, people are afraid of what they'll find, or if they don't have health insurance, they don't want to incur the medical bills that might result as after they go and get that checked out. So they're just not going. It's really heartbreaking to hear the decisions that individuals are making, not putting their health first, not taking care of themselves as a result of certain financial situations within our state and region.
I know a couple of people that's happening to.
So how does Komen help those women who may say, step forward and finally do that mammogram, and let's say that they do find out they have breast cancer or some other?
Great question. So on the Missouri side, there's a program called Show Me Healthy Women. On the Kansas side, there's a program called Early Detection Works. Both are state-funded programs that anybody who does not have health insurance can go to either Show Me Healthy Women provider or an Early Detection Works provider and get a free screening mammogram.
Early Detection Works.
Correct. Or a free pap smear. The beauty of going to those programs, if you are uninsured, is if something's detected, you are fast-tracked into Medicaid.
Really?
So what's really important to us at Komen is not just covering screenings, right? Because if something is found, then what do you do, right?
That's just
if
the
they
beginning.
don't have health insurance, that's just the beginning of it. So we want to make sure that everyone knows these programs exist in Kansas and in Missouri, that they take advantage of them. What we're doing on the Komen side, there are certain parameters that people must meet for both of those programs. We're covering screenings for those that don't fall in those categories because we want to make sure that every single woman is screened.
How much of an issue today is it convincing women to get a mammogram, not because of cost, but that's going to hurt? Scared of the mammogram?
Yeah. I don't know. That's an interesting question. We haven't actually dove into that. The challenge has been how scary the health system is, or healthcare in general is, the cost associated with it, the process, not trusting your physician. And what we've discovered kind of throughout the state, on the Kansas side at least, that hospitals are closing, rural hospitals close, physicians retire, and then they're not replaced. And so communities lose that trust because those are the people that they've relied on and gone to for 30 plus years. And they're having to find a new physician to help them make those decisions, to inform them about screening, to educate them about what a mammogram will feel like or what that experience will be. And because some of these challenges are happening throughout the region, they're just not going now.
Oh, that's so sad. Because, it's on my checkbox, and I'm in the category above 40. My sister was detected through a mammogram. She has just gone through a year of dealing with breast cancer. Thank goodness. Hers was caught early, etc.
Yeah.
And I know the kinds of fears she had as somebody who was lucky enough to have insurance and moved it forward with her doctor. So there's so many questions. You alluded to there's been some change in the organization itself. And a refocus. Can you share with us a little bit what that means so people will know
Happy to.
what to watch out for?
So April 1st, which is our start of our fiscal year, we're launching a brand new community investment strategy, and it is specific to our region. What we will do is we are continuing to fund. We have a RFA open right now where we will fund projects that are focused on patient navigation or education, whether that be general public education in a one-on-one setting or in a group setting. That's evidence-based that results in behavior changes. We're not interested in health fairs necessarily because that's not evidence-based in action, meaning we want people to do what they learn, right?
Right.
So we have that approach. The second community investment strategy we are launching that we are very excited about is our Breast Health Assistance Fund. That'll launch April 1. What we will do through that is partner with a couple of clinical providers who will execute screenings for those that cannot afford screenings. The second piece of that, we will fund financial assistance for those post-diagnosis. So covering a copay for them, paying for a prescription drug, paying for their mortgage or their rent, paying for daycare, because there's a lot of costs associated just beyond the medical bills. And we want to make sure, and we know, and we have thought very long and hard about this, that might save somebody's life if they go to their doctor's appointment, right? If they go to their screening, if they go get their radiation treatment, and we cover their daycare because they're not able to afford that. We're solely focused on saving lives, right? So that's the Breast Health Assistance Fund. The third one is a bit more progressive. No other Komen affiliate in the United States is doing this. We're launching an impact fund. What this fund will do leverages the amazingness of Kansas City. Kansas City is, thanks to the legacy of Ewing Kauffman and Marion Laboratories that he established, Kansas City is home to the largest concentration of clinical research organizations. There's incredible drug development, drug discovery, drug delivery research that's taking place in Kansas City. And we want to leverage that. We have the largest.
Didn't know that.
We have the largest health endowment in the world in our backyard via the Stowers Institute for Medical Research, thanks to the foresight of Jim and Virginia Stowers. Jim Stowers founded American Century, as you know. We are so lucky in Kansas City. So you talking about it not being a flyover, it is not. There is economic development in the healthcare region that we have a lot to be proud of. And so knowing all of that, we want to leverage that. We don't want to miss an opportunity to fund what could potentially lead to a cure. So let's say there's a phase 3 clinical trial. I know I'm talking a lot.
No. We're looking at the time. We get that.
Yeah. You got to monitor, right?
Yeah. No. Well, they tell us 5 minutes. Sorry, everybody. Like
No.
We have a producer
Your
behind us,
periphery, right?
And then, so she thought
the secrets of radio.
Yes.
So let's say there's a phase 3 clinical trial taking place in Kansas City because of all this great stuff that's going on. And it is for triple negative breast cancer. They're having a hard time recruiting patients. We invest some marketing dollars behind it. They recruit the patients. And what if that's the cure for triple negative breast cancer? We want to be able to invest in things like that. So we're looking at our impact in our region a bit differently. It's not just about education and printing out, pamphlets for health fairs. It's about action. It's about behavior changes. And it's about leveraging what's in Kansas City to help find a cure. Because at the end of the day, we want to intentionally go out of business. I don't want to be around for 20 years. I'm not putting a 20-year plan together because we shouldn't be around in 20 years because we want to achieve our mission.
You said you're not a big events person. Will there be events?
Of course.
So, because I always remember the Komen Walk.
Yes, that is still around. And,
okay.
We have Komen, Komen's hallmark is Race for the Cure, right?
Right.
And quite frankly, there's a walk or a race every single weekend now. Thanks to Komen and the legacy they established, right? So we will always have the More Than Pink Walk here in Kansas City as well as in Wichita to help bring the community together, make people understand and create some camaraderie amongst the survivor community, as well as raise important funds for this new initiatives that we're doing.
Go ahead. Were you about to say something?
We both have so many questions.
So I was going to say, you know, with the growth and with all of the I guess you'd say governmental changes, have you seen, I guess, more funds being dedicated to breast cancer awareness?
No.
No,
not at all.
Oh,
no.
okay.
That's
okay.
why the work we do is so important.
Yeah.
We fight every year in United States Congress to ensure that there's still federal funding for the fight against breast cancer. Those dollars kind of come through the Department of Health as well as the Department of Defense, which is really interesting, right? And there's a history there.
She saw my head perk up. I was like, really?
It is interesting, but we fight every year to make sure that those at least sustain. But because women are living longer now as a result after a diagnosis, there's new challenges that people face. And there's new research avenues that we need to investigate. So unfortunately, no, there's not enough dollars out there to fund. That's why nonprofits like Susan G. Komen, Kansas, and Western Missouri is very important.
How can people help? How can they help you?
Oh, we would love for them to be informed. One, we want them to, again, I'll end with our website, but I want people to take action and make their health a priority. 100% take care of yourself, because again, we don't want to be here forever. We want to achieve our mission to end breast cancer forever. But if they are interested and they are looking for resources, visit our website, Komen-Kansas.org, and we would be more than thrilled to have anybody involved, to donate, to invest. So I won't say donate, I'll say make an investment in us, and we will honor that investment and prove and be transparent in the work that we do.
Erica, thank you so much. And thanks for listening to KC Cares, Kansas City's nonprofit digital resource. We're produced by Charitable Communications. KC Cares is generously underwritten by the Ewing Marion Kaufman Foundation. If you would like to support our efforts in sharing the stories of nonprofits, underwriting opportunities are available on our website, kccaresonline.org. Spread the love. Find us on Facebook, Instagram, Twitter at KC Cares Online.
And KC Cares podcasts are available at kccaresonline.org. And thank you for listening to KC Cares on ESPN 1510 and 94.5 FM.
ESPN Kansas City is KCTE Independence and K233DM Raytown, 1510 AM, 94.5 FM.